All of the healthcare systems in the Portland metro area say they're now following updated guidance from the CDC. That means COVID-positive healthcare workers are allowed to return to work sooner. Fox 12's Sarah Hurwitz joins us now in studio with how nurses feel about the impact this could have on both healthcare workers and patients.
Well, yeah, Nora, simply put, the Oregon Nurses Association is concerned that this new guidance is a risk for everyone's health. Last month, the Centers for Disease Control and Prevention updated its guidance, which would allow COVID-positive healthcare workers to return to work sooner. That new guidance from the CDC says those workers can return after 5 days with or without a negative test if they're asymptomatic or have mild improving symptoms.
It's an extraordinary gamble with nurses' health, with staff health, and with patients' health. What it does is it creates a petri dish of infection. It creates a situation where you might go into the hospital because of a car accident and you leave with COVID-19.
Kevin Mealy, spokesperson for the Oregon Nurses Association, says that he's disappointed and frustrated by this guidance from the CDC, which he says continues the cycle of infection.
You may be up to 30% transmissible after 5 days. So what that means is you're bringing in hundreds to thousands of additional people with COVID into the hospital setting.
The CDC says due to concerns about increased transmissibility of the COVID-19 Omicron variant, it updated its guidance to enhance protection for healthcare personnel, patients, and visitors, and to address concerns about potential impacts on the healthcare system in a surge of COVID infections. It also added options for asymptomatic healthcare workers who have not received all COVID-19 vaccine doses, including the booster dose, and have a high risk of exposure. Now, previously, the CDC recommended that they wait 14 days after they were exposed to return to work. The new guidance allows them to return to work sooner if they do not develop symptoms or test positive for COVID. And during an Oregon Health Authority press conference Thursday, Fox 12 asked how these updated policies are safe.
There are contingency plans in place so that if staffing is at a shortage level that could impact the ability to provide quality care, that using testing and other methods to bring those who are asymptomatic after a period of time, wearing masks and using PPE, personal protective equipment, in a consistent way can bring people back to work sooner. Do so without raising the risk of spreading COVID to those around them, including their fellow staff members or patients.
And the Oregon Nurses Association also says that these new CDC policies don't seem to be designed to put healthcare worker and patient safety first, but really to keep hospitals fully open. It says it'd be better to triage services like stopping elective surgeries, limiting visitors, and putting more emphasis on prevention. Reporting live in studio, Sarah Hurwitz, Fox 12 Oregon.